So Friday of this past week was probably the low point of my experience taking care of our patients during the COVID-19 epidemic. Um, that morning I was working out of the Hub of Hope, which is a health clinic that we run in the sub-basement of Suburban Station. That site is an engagement location for unsheltered citizens of Philadelphia where we offer shower, laundry, medical care, and social services. But what I remember about that day was the fact that I had to test a patient for COVID-19 and then had to discharge him to the street because we had no options in terms of providing shelter for an individual who we presumed was positive, um, but had no place for him to go. Um, and this awful decision came out of really hours of advocation on his behalf with the city of Philadelphia, who was unable to provide shelter for him, or um, trying to cajole hotels to open their doors to allow this individual to have medical um, quarantine for a 5-day period while we were waiting for his test result. I left that day feeling like I had failed in terms of my oath as a physician. My name is Patrick Doggett. I'm a 2004 Philadelphia Corps member. I work with an organization called Project Home in Philadelphia, which is a nonprofit that works to break the cycle of poverty and homelessness through affordable housing, employment, education, and healthcare. We operate 3 healthcare centers in some of the zip codes with the greatest health disparities in Philadelphia. And then we also have a large portion of patients who are unsheltered. Um, like many primary care providers, we're not unique. We have found that during the COVID-19 epidemic that we've had to completely change our care delivery model, moving mainly to telehealth. While this model is wonderful for promoting physical distancing, I'm super concerned about our isolated patients who may not have access to a telephone or a working phone number, um, because I'm worried that this new modality may be unintentionally reinforcing or even worsening some of the health inequities for our patients. I think what we've also been seeing over the last um, few weeks is the really disheartening reality that the city of Philadelphia was ill prepared to support our over 5,000 unsheltered citizens. Um, since the start of the crisis, there has not been a coordinated plan to provide either temporary shelter for people experiencing homelessness, um, or for medical quarantine, or even for healthcare across the city. Our shelter systems are ill-equipped really to meet the CDC requirements for appropriate physical distancing, and hospital beds are a precious commodity reserved for those who are ill. So people who are exhibiting mild cases, would typically be told to stay at home and symptom monitor. It's not an option for people who are unsheltered. To date, the city has promised 1 hotel as a medical respite and quarantine, um, but it's still not fully up and running. From what we've been told, the criteria will probably make it very difficult for our patients to gain access to that location. So I think, people have asked what we can do, or if I have any recommendations for how people can be helpful and during this period. And I would, I'll echo the really important, obvious ones of, promoting physical distancing and making sure that you're engaging in good hand hygiene. Um, but aside from that, I think things that are really important are: 1, check in with your neighbors who are elderly, isolated, and medically frail. We need to physically distance, but there are ways to check in and let somebody know that you're thinking about them and that you're there to support them. I've been humbled by the number of times that people have thanked me for calling to check on them this week. And this simple act of kindness can just mean a lot. I would say ask what your local area is doing to support people experiencing homelessness. Part of a robust and effective public health approach to COVID-19 ensures that our shelters are spaced far enough apart in terms of beds for individuals, so that we're observing the recommended physical distancing, and that there also is sites for medical quarantine for our unsheltered residents. Unfortunately, this is only happening in our most progressive cities. So, my recommendation is ask what your municipality, your city is doing to make sure that our homeless citizens are being cared for. And if there isn't a plan, be willing to advocate for them. The media is one of those outlets that we're finding has power during this time to help to promote change. And I guess my last thing would be, and somewhat selfishly, is to check in on the family of healthcare providers. As stressful as it is for me on a day-to-day basis, those feelings are just magnified for my family. I know my wife, who's home with our 3 kids, is rapidly approaching sainthood as she's now adjusted to working from home and parenting our kids while also figuring out what school looks like. And then also add on me coming home at the end of the day, potentially increasing our whole family's risk of being exposed to the virus. So thanks for the opportunity. I think that there is a lot of really challenging things that everyone is experiencing at this time. But I really am grateful for the platform to just talk a little bit about how our experiences in Philadelphia have been through this first part of the epidemic. I encourage people to stay safe and please continue to care for each other.